Hello. Hello, everyone. Welcome, welcome, welcome. I'm waving in two directions because I am live on Instagram and live with all of you here on YouTube. And I haven't been live on Instagram in ages. So I'm back with all of you and back here with all of you here. So welcome, welcome, welcome. So nice to be here with all of you. So really, this was a very impromptu um, event. This was not something I planned to do today, but with everything that's gone on for me since the start of the year, I thought this would be important for all of you to do. And so we're going to do a couple things, but before we dive into it, I want to welcome all of you. I want to say hello. I want to hear from all of you. So as you are all here, and joining, I want to know where in the world you all are. So please say hello, drop it in the comment, and let me know where in the world you are joining me from. I always love knowing that and connecting. But today is going to be all about answering your questions, giving you answers to your fertility questions. So that's what we're going to do. But as we get started, I really think it's really important to pass on some intention and clarity for this year of 2026. So as we do that, we've said, Mazatlan, Mexico, and BC, Canada, welcome. And we've got Sacramento and Minnesota, welcome, welcome. So let's pop in, where you are and just say hello. I'd love to have that. I'm not going to get to questions just yet, but if you have them, you can just pop them in, and we're going to go grab those and collect them and answer those as best we can. Welcome from Miami and from Ontario. I was just in Miami Beach over the holidays, and there's Texas. Wonderful. Howdy to you in Texas. So nice to have you all here. So as everyone is joining, I think the way I would like to start our live is to go over a couple of things, right? Because I want to put some intention behind this year for all of you, and I want to help you do that. A couple of reasons why I decided to do this, by the way, because it was very impromptu, short notice. It was literally on Monday. I was like, we got to answer some questions, and there are two reasons why I wanted to do this for all of you. The first one was because we've had a lot of new positive pregnancy tests since the end of last year and the beginning of this year. It was a nice way to end 2025 and an amazing way to start 2026. And I want to see that continue for all of you. So that was number one. Number two is that I've heard some crazy stories in the last couple of weeks around people's experiences at fertility clinics, their conversations with doctors, their struggles. Their hi from North Carolina, their struggles, their confusion about how to move forward and what to do this year and so forth. And so I thought that would be that those were good reasons to create a live where I'm going to be here just answering your questions. But instead of just answering questions, I wanted to have some purpose behind it. So here's an exercise that I want all of us to do as we're going to dive into some questions in just a minute. But I want us to set, excuse me, I want us to set our intention for the year of 2026. And I want you to do that. I want you all to do that because you're going to actively participate in this right now, okay? I want you to do that I want you all to write down 3 things you want to accomplish with regards to your fertility this year. And here's the thing. I don't want to hear that, I want to get pregnant. That's a given, right? So what I want to hear is that, I want to support my digestive system, or I want to find real answers to my fertility struggles, or I want to be pregnant by June, whatever it might be. So this is your homework. I want you all to do this right now. 3 things that you want to accomplish this year having to do with your fertility. And I promise we'll open up for questions just a minute. This will be easy, straightforward, and quick, but it's impactful and powerful for all of you. And so I want you to do this. Okay. So once you write down those 3 things with regards to your fertility that you want to accomplish this year, okay, then we're going to divide them up into the year. Which one is priority number 1? How are you going to accomplish that first? So we're going to use this because someone just put this example in here. So she said improved digestion, better quality sleep, and improved ferritin levels. That's awesome, right? So that's great. So those are the 3 things that they want to accomplish this year. And now we're going to say, well, how are we going to prioritize those things, right? So, by the way, all of those things for some of you might not be important for fertility, but for me, those are. If we can improve, I'm going to go back to that list. If we can improve her digestion, improve her quality of sleep, and improve her ferritin levels, she is going to have a much better chance of conceiving this year. Okay. And that's the goal that we want. So all of your goals don't have to be specifically around fertility. I actually had this conversation with someone today because she was saying, I want answers to my fertility. I hear this all the time. Even after I've given members answers, they want to be like, well, I don't know why. I'm like, well, we talked about it. I gave you your plan, and it lists in the plans that I give the Hope members, it lists all the things we're working on. And those are the reasons why we think that they're not able to conceive. Not all fertility struggles and difficulties and challenges have to do with reproductive issues. So she was still diagnosing herself as unexplained because she didn't have technically a reproductive issue. Okay. But she had inflammation. I'm trying to think of all the things she had that we were talking about today. I can't, it escapes my mind. But it could have been digestion, sleep, and ferritin levels, right? Just like that. And those things are going to impact your fertility. So if we can improve those things, we can get you closer to conception. So what I want to see from all of you is, sorry, I'm multitasking because I have Instagram over here and YouTube over there. So what I want to see from all of you is that you've listed those 3 things, and now I want you to divide them up into the year. Okay, we're going to divide the year up into thirds. I know you're usually used to doing that into quarters, but we're going to do it into thirds. And between now and through April, you're going to try to accomplish the first thing, the most important thing. Okay, and then the next 4 months is the goal to accomplish and repair the second thing. And the last part of the year, you're going to do the third thing. Now, if you get it all completed, let's just say, hers was digestion. If digestion is all fixed in 2 months, you don't have to wait to do the other. You can move forward with that. But that's how I want you to think about accomplishing these tasks, okay? By the way, you could do this in all aspects of your life. We're just focusing on fertility right now, okay? And then now, after you've done that, I want you to then say to yourself, this is the first thing that I'm going to do tomorrow to get me closer to my goal of accomplishing these tasks. You have to decide what that is because I don't know what your 3 things are, but I want you to put that down on paper. And then you have to schedule this into your calendar to accomplish these things. How are you going to do that? I'm going to go food shopping. I'm going to buy better quality food, or I'm going to get support, right? Like if you need help to support your digestive system and your sleep and your fertility, then who's going to support you and what are you going to do to get there? Okay. So this is really important. The last note that I want to leave you on before I start collecting questions and answering your questions is it's really important that when you do this, you stick to your plan. If you've got a process, you're sticking to it. If someone has given you recommendations, you're sticking to it. Like when I give somebody recommendations, we don't alter things unless there's a real reason to do it every week, right? We're doing this every 2, 3, 4 months. We're looking, reevaluating, and potentially adjusting things. So you have to stop second guessing yourself. You have to follow the plan and the process. And that is going to get you more closely to your goal. If you're constantly adjusting and changing things, you're not going to, it's going to be more difficult. I don't want to say not, it's going to be more difficult to accomplish your goals. Okay. So that's what I want to see from all of you. If this is helpful, give me a thumbs up in the comment section. If you have any questions about this, you can post it in the comment section. And if you've got questions about your fertility, go ahead and post it into the comment section. I'm going to do my best to answer those questions. Okay. And we're going to collect those questions and we're going to move forward from there. So I already have some questions collected, but again, this time is for me to be here to answer your questions. Thanks for the thumbs up. To be able to support you. Okay. So let's start by collecting your questions. I'm assuming if you're all here, you've got questions about your fertility that you want answered, and I'm here to answer them. So the first one, I think it's from someone named Michelle. It says, I'm having my embryo transfer February 4th. Amazing. Congratulations. I love to hear it. I'm 43. Please tell me all the tips, what I can eat, drink, and what to avoid. Okay, I love it. All the tips. So here's going to be the challenge that I'm going to have, and I'm going to give you my best suggestions, not knowing much about your situation. Okay. So most of the time, Michelle, my suggestions are based off of me understanding a history, understanding what you've been through, blood work, and so forth. You know, these Q&As don't allow for that, and that's just the nature of it. But we're here to support you as best as we can. Okay. So with that, now's not the time to change much. That's first and foremost. It's also not the time to question much. Now's the time to just follow the process. The only reason to question or alter things at this stage, if you're having an FET, a frozen embryo transfer, in the early part of February, is because something's gone wrong, right? Like your lining might not be thick enough. You might not be getting the support that you need. So that would be the reason to do that. So otherwise, now is the time to stay the course. In terms of eating and drinking, now no alcohol, little to no caffeine, lots of water, stay hydrated, lots of clean, healthy foods. This is not the time to be on junk food. We had that during the holidays. Now we're cleaning it up, okay? And now is the time to just work and focus on simple, easy to digest foods that are nourishing to you, lots of protein, lots of healthy fat, lots of veggies. This is the time to focus on that. It's also one of my suggestions is to get acupuncture this time around your FET. And I also suggest doing that in conjunction with your embryo transfer, meaning on the day of. There's lots of good research to support that. So I would recommend that. And then in terms of things to avoid, like now's the time to take it easy. You know, like I said, don't start anything new. If you are exercising strenuously, now's the time to pull back on that. So those are just some simple tips. Keep your feet warm, keep your low abdomen, low back warm, eat warm foods. Those are the basics that I would suggest for you when it comes to an embryo transfer without knowing much in your situation. Okay. Someone asked, I am endometriosis free and I didn't have to go through surgery. Okay, really not a statement or not a question, but a statement. So I love to hear that. And I love this too. She said she was sharing her 3 things that she wants to accomplish this year. and she said, I'm fasting from certain foods. My guess is that you mean that you're eliminating certain foods. You want to travel in nature. I love that. Me too. And you want to have better digestion. So now it's about putting those in place, putting the pieces in place to make those things happen. Okay. Another wonderful question here is about sleep. What can I do to improve my quality of sleep? Okay. So sleep is hugely important. I think having a regular time to go to bed is really valuable. So always around the same time, like I'm going to get in bed by 10 to be hopefully sleeping by 11. No screens for at least an hour before. Okay. And I'll get to your question just a second here on Instagram. I see some of them here, so I'll get to those. No screens at least an hour before. Try to have a room that's all black. You could put on some like a noise machine that often helps. Sound machine. You can do that with your phone as well, so that often helps. And then we don't want to eat too close to dinner time, too close to bedtime, excuse me. And then additionally, one of the things that I think could be very helpful, and also could be helpful for your fertility, is adding in some melatonin that you can take right before bed. Another one I like is some magnesium. So those would be two things that I would say you could put in that could be helpful. Okay, so let's scroll here. I know there were some things that got stated. Okay. Okay, did you write something else here? Let me see if you had said something else. Oh, yeah. 5 years of trying up until now, only thing found was lower AMH. Recently discovered high thyroid antibodies and high fasted glucose and insulin. So I'm going to tell you the AMH for me is not a reason why you haven't conceived. That might be a reason for IVF, but that's not a reason why you haven't conceived. But the high thyroid antibodies, the high fasting glucose and insulin, those are reasons that have made it more difficult for you to conceive. She says, have been adding in supplements and making lifestyle changes, but due to IVF funding and timing in BC, British Columbia, Canada, I'm starting injections on Saturday. Any device going into this, feeling torn with timing and wish there was more time to work at lifestyle factors. I mean, I don't know how long you've been working on lifestyle factors. It's mandatory. You have to move forward with the stimulation injections now for retrieval. If there's a way for you to put that off, then that might be something to consider. Otherwise, there's really not much to change at this point in terms of suggestions. I don't have them because, again, I don't have your specific history, although you gave me some, but it's not enough. Plus, today's Wednesday and you're starting on Saturday. So I think at this point, we've got to give it the best we can and trust in the process unless you're able to make those changes with your lifestyle and so forth. 9 years and no pregnancy, no chemicals or miscarriages. Husband's morphology is 1%. Could this be causing no pregnancy for so long? What else should we test for? Had chromosome testing and it was okay. So this is interesting. I had a similar conversation with someone today, although I think for her it was like 1.5 years of no conception from trying, not even a chemical. Without seeing the rest of your husband's semen analysis, I don't know if 1% is a problem or not. My assumption is that it might play a small role, but I would have him tested for DNA fragmentation and a test called sperm QT. That's what I recommended to her because this would tell us if trying naturally or IUI would even be successful for you. But I don't know. Well, if you're in the U.S., you can get it done. I don't know if you can get it done in Canada. So hopefully that's helpful. That would be like the first thing that I would do. The other thing potentially that you could do in terms of testing would be to do some to test for implantation issues and uterine issues. So potentially test to see if there's anything going on with the microbiome in the uterine cavity or the vagina. That could be something that's been hidden. It's been a long time that you've been trying and without success for that. So we have to start to think outside the box a little bit, which for me, that's not outside the box, but could be for you. So it's something to consider as you're starting to move through this process. And someone says, I've picked up a smartwatch and that's been helpful for me with sleep. I love that for you. I'm glad that has been. It has not been for me. Like those don't work for me for helping me sleep. They actually make it more difficult and challenging for me to sleep. But that's good to know. And then one more here, and then we'll come back to you all over there. Can a deep fissure and IVF procedure work simultaneously? If not, then is LIS the only solution? Is it safe to have a surgery before? So that's complicated. So I would say, yes, I think that might be the only way to move forward. And then in terms of surgery before, I think there's other variables that we need to consider. I need to consider the entire picture. So it's difficult for me to answer that question without knowing more. And I don't want to misguide you. So I would need to understand a little bit more around that before I were to be able to answer that question. Okay, let's see here. Someone asked, and we see a bunch of questions here, so that's good. Give me one sec. So how does Hashimoto's play a role? I'm on thyroid meds and low dose naltrexone, LDN. What else can I do to reduce antibodies? So your thyroid meds don't usually reduce your thyroid antibodies. They're going to focus primarily on your thyroid stimulating hormone, your TSH. LDN can be beneficial for that, depending on how long you've been on it and the dose. I would say, you're going to have to monitor your progress and your levels ongoingly. But other things that I would be doing is focusing on lifestyle factors. So being on a autoimmune paleo diet, so it's an anti-inflammatory diet, is very, very important. Managing your lifestyle, not overdoing it, getting exercise, but not overdoing your exercising, getting plenty of sleep. We're trying to manage your immune system and your immune response. So I think that would be very, very important for you. Okay. And something that I would recommend. Those are some key things. And then typically I do add some supplements as well that can be very helpful. But without looking at your entire picture, it's going to be difficult to see that. By the way, for everybody who is joining us, this is exactly what we do in the HOOD program. We review your entire case. We review your history, lab work, and so forth. We guide you and support you throughout that process. And then we create a plan for you specifically, customized to you and your needs, to help get you the results that you're looking for. So if this is something you're looking for, we just drop that link in there to set up a discovery call with my team. And this is where we'll talk to you to see if we think we're a good fit to support you and learn more about your situation to see how we can help you. Okay, so next question. How can I relieve constant bloating, and what is this indicative of? Currently on the Candida protocol. So constant bloating can be coming from several different things. It could be coming from overgrowth of Candida, and if that is, then hopefully the Candida protocol is taking care of it. Otherwise, something that this could be indicative of is SIBO, small intestinal bacterial overgrowth. And so that requires a specific test for that. And then if that is the case, then a specific, plan forward for that. Okay. How to improve low progesterone levels. I take a bioidentical supplement the second half of my cycle, but really don't want to be on that and want to help my body bring my progesterone up. Okay, so some simple things. So one, we have to see if there's anything else underlying that might be contributing to that. I don't know that information, so I can't answer those things, so I can't comment on it. What I can tell you is that often you are lacking in magnesium, and you need some magnesium, and you also need some vitamin C. So those would be two key things that I would say that you can easily add in. And then theoretically, there could be more that we could do once we understood your entire picture. I do have several videos on this topic, by the way, on my YouTube channel, Fertility TV, that you can check out. Okay. Oh, I clicked the wrong button. Okay. Let's see here. Just had my second natural IUI failed. Sorry to hear that. Onto my third. Cycles are regular, ovulate, and called when I received my smiley for the next day IUI. Working with Shady Grove, should I do ultrasound and trigger? I think you're probably going to have a much better chance to do an ultrasound and trigger so that they can time it more specifically for you. So that would be one. Number two is I typically also recommend doing back-to-back IUIs, so consecutive days, not consecutive cycles, although that's fine as well, but consecutive days. So IUI, let's say on Friday and Saturday, or whatever that might be, with your ovulation window. And I often find that to be highly successful. Okay, so let's see here. I think I saw some other questions here. For sleep, how much melatonin and magnesium is ideal? I don't like to exceed 3 milligrams of melatonin, so that's usually where I start and stop. And then magnesium, somewhere between 300 and 400 milligrams of magnesium glycinate. I just want to say a special thank you. I wish I knew who this was. 5 years ago, I had a miscarriage, and your recommendation was to get a cerclage. And I'm happy to report that I am now mother of a healthy baby girl. Oh, congratulations. Love it. Super, super happy for you. And I appreciate you coming back on and letting me know. Thank you. Another question. After doing endometriosis surgery in September, I have an upcoming FET, frozen embryo transfer, in January. Do you recommend prior to FET that I do additional suppression, or is a laparoscopy enough prior to the FET? I don't know the severity of it. You might need some additional suppression. That might be something to discuss with both your REI and your endosurgeon to see what they thought. That's usually who I lean on for that because they're looking at everything in real time, and your endosurgeon knows everything, specifically for you. So I think that's really important. All right, let's see here. Let's look at some other questions. Okay, we got that one. Sorry. We got that one. Good. Okay. Someone asked a question. I have really bad gas. I apologize for that. How can I control it? I mean, I would start with diet. I would start with food. What are you eating that's contributing to it? I would start with an elimination diet, and then really pay close attention to what you're eating and how you're eating it, like how it's prepared. Is it raw? Is it cooked? Sauces and so forth. So that's where I would start with that. Remember, this is for all of you. So if you've got questions, I'm here to answer them. Okay, everyone? Someone says, I have PCOS, 43 years old. AMH is over 4. How to improve egg quality and enhance fertility. So I don't have a lot of information to go on, right? What I can tell you is that your AMH is high at 4. That tells me you've got plenty of eggs, but we need to nurture those eggs and make sure the quality of those eggs is good. Without seeing your entire picture, without understanding your entire situation, I don't know, because I don't know what the underlying issues. There's PCOS can be different from one person to the next. PCOS, this is my little guy. He wants some attention. PCOS is different from one person to the next. So what I mean by that is you could have a classic presentation of PCOS, or you can have you can be dominant in one area or the other, meaning you have your issues are more predominant in one specific area, let's say androgens or blood sugar or stress, whatnot. And so we really need to understand what that is. I love supporting PCOS. The first woman I ever helped had PCOS, and I truly believe that all women with PCOS should be able to conceive, at least 90% of them naturally, and that's what I've seen to be true clinically, with the right support. And so we need to make sure that you're getting the right support. I don't have enough information to be able to guide you. So it's difficult for me to say, but what I can tell you is it's not just about supporting egg quality. I would really be trying to understand where your hormone levels are off, what your issues are, so that you can be supported specifically based on your needs, like what's off for you. Okay. All right. Let's see here. Do you recommend surgery if there's one tube blocked? What kind of surgery? Like to remove the tube? Possibly. It depends what the circumstance. Like, is it inflamed and is it causing more problems inside the uterus? That could be a reason to have it removed. So that's something to consider. Yeah. Okay. So let's see. What's the other question here? Does DHEA operate as birth control? No. I feel like adding DHEA threw my cycles out of whack. Now, it may have thrown your cycles out of whack, but it doesn't act as birth control. Okay. And those are two very different things. What I will say about that is, did you have your DHEA tested before you started taking it? If so, what were the levels, and did that help guide how much DHEA you were going to take? I don't recommend DHEA just like being taken by anybody. And typically what you see around is to take 75 milligrams, which I often think is just way too much. So unless we know your specific levels, that would dictate what I would do for you and what I would recommend. Okay. So if DHEA is causing an issue for you, then certainly back off and let's stop taking it for the time being. And then I would have your levels tested. Can you still get pregnant with high prolactin? So if the high prolactin is on the low end of high, then the answer is possibly. If the high prolactin is higher, then I would say you're going to have a hard time. They recently raised the low end, the range, which used to be around 24, 25 on the low end, is now I think 32 on the low end. So I look at prolactin differently based on that. I would say if you have one reading that is elevated, I would suggest getting it redone and make sure that you're fasting for it and that you haven't had intercourse within a couple of days of doing the test, because I think that will be important to get a clean reading as well. Okay, let's see here. Sometimes I have high within the normal range prolactin. How do I better manage lowering these levels? Okay, when should I be testing for prolactin, and is it crucial for those levels? And when is it crucial for those levels to be? I didn't understand that last part, but what I'd say, what is the root cause of upper bound normal prolactin levels? So it could be a lot of things. Stress is a big one. I will say that if you're having regular higher prolactin levels, do what I just recommended, which is make sure you get it tested, fasting, no intercourse near it. We want to make sure that it's a clean reading, and you can do it at any time of the cycle. That's fine. And then what I would also say is if it continues to be high, then you might need to rule out a pituitary cyst, sometimes referred to as a pituitary tumor. They're usually benign, but they impact your pituitary gland, which causes or can cause your prolactin levels to rise. Okay, let's see here. Had DNA fragmentation 3 years ago, good range, but found leukocytes in the sample. Other parameters regularly mid-range. Husband is healthy, but cycles is a main exercise. But cycles as a main exercise. Sorry. What is the sperm QT test? Yeah, it's testing for the microbiome in the head of the sperm. You can look it up. I would have that done. And the leukocytes need to be addressed. That can be a problem for fertility. We are in Canada. Same person. Okay. Some testing not available. What kind of tests are used for implantation issues? So there's your testing. If you're familiar with like an EMA or ALICE test when you do IVF, they're testing for those things: infections, inflammation, bacteria, good and bad in your uterus. You can also do a vaginal swab as well, but I like to use a company called Evie for the vaginal swab. Someone who's in my program says, I'm currently a HOPE member and have my plan. Awesome. My biggest struggle now is a very long period, currently working with an acupuncturist to help with it. If we haven't recently adjusted your plan, then or recently done lab work, I should say, then I would suggest reaching out to my team so we can order new lab work for you, because I like to do that periodically. I would have written that in your plan. And typically in all plans, I'm telling you when I want you to reach back out to me so that you can, so we can connect, run new lab work, and adjust your plan. I don't want you to be on your plan indefinitely. So that's something to look at. If it's a new plan, because I only say this because I don't know who it is that's messaging me. If it's a new plan, relatively new plan, then we need to give that a little bit of time to work to see what progress we're making before we make some adjustments. So those are my feedback to you. End of February is the 6-month mark after I had LIT, L-I-T. Is it contraindicated to have a follow-up LIT before the 6-month mark ends? Just looking to avoid out-of-pocket costs of the labs they require. You should not have to. Let me read that again. No, you shouldn't have to have it again before the 6-month mark is up. Yeah. Let's see here. Yeah. So Glenda. So I would say yes. It's been a while. So. She told me her name, so that's how I know. So I would ask you to let's retest. Let's adjust things. Let's look at what your current labs are now, and then we can see what needs to be adjusted. So it would start with retesting. Okay. All right. So Peachy Vibes. Wow, we've got a lot of people from the program here, so that's great. She says, I'm new to the program, received instructions for 2 requisition forms. Yes. Could I please explain the requisition form? So requisition number 1, by the way, you should be joining our group calls for that. Okay. Yeah, I'm happy to answer them here, but I won't always be live here. So our group calls are every Thursday. Number 1 is to be done fasting. So at least 8 hours of fasting, and on cycle day 2, 3, or 4, where cycle day 1 is your first day of bleed. Okay, so first day of bleed, and then the next day is day 2, 3, or 4. That's when you want to do requisition form number 1. Requisition form number 2 is 7 days after ovulation. So you track your cycle, find out when you're ovulating, and then count 7 days, and that's when you would do that next test. Hopefully that's straightforward for you. Okay. Do you think if my thyroid is 2.46 and prolactin is 43? Oh, what do you think if my... So I think your thyroid is okay, but if it continues to creep up, your TSH is what I think you mean, then I think that's going to be a problem. And prolactin at 43 is too high. So if you've only had it tested once, I would have it retested. If it continues to be high, I would go see your endocrinologist so they can do an MRI and potentially put you on medication. The ideal prolactin level is under 30, and even lower than that if necessary. Okay, let's see here. Sorry, I'm just filtering through questions, everybody. My periods were painful my whole life, but became much less painful after my miscarriage in August. Does this change in pain suggest I do or do not have endometriosis, and what are criteria for diagnosing it? So it's hard to say. That's a great question. I don't know why, unless there was something inside your uterus that would have caused that would have come out during the miscarriage, like a polyp or multiple polyps or something else that would have contributed to this. So I do think that that's something for you to look at. Does this change? No, I mean, if you no longer have pain, then I think we're moving in the right direction. If you continue to have pain, I would say you want to see an endo specialist just to make sure to rule it out, because just because it's gotten better doesn't mean that it's gone. Yeah. There could have also been now thinking about it, there could have also been some inflammation, maybe some other abnormalities and issues inside the uterine cavity, inside the endometrium. And then with the loss, it cleaned everything out. And now everything has, returned closer to normal. So that could be the case as well. I'm currently limiting gluten, dairy, but I just looked up the autoimmune paleo diet, and it says to limit nuts, seeds, and legumes. I have psoriasis, so should I limit those too? I don't know if you were the same I'm not keeping track of who's asking all these questions. So if you were the same person that asked the question around Hashimoto's, where I mentioned it, then I would say yes. I mean, if your intention is to follow the AIP diet the way it's intended, then I would eliminate all of those things. Or if not, you're not following that protocol closely enough. Okay. Let's see here. Okay, so let's go back here. What could be causing premenstrual spotting? So for 5 to 6 days every month, even on long-term progesterone suppositories. So you spot for 5 to 6 days every month pre-menstruation, and you've been on progesterone suppositories long-term. I have 1 centimeter intramural fibroid, which could be causing the spotting, by the way. And also high anxiety, anything to improve this. I would say that my assumption is that it's coming from the fibroid, unless there's some additional like polyps in the uterus that could be contributing. That's my speculation just from this initial information, because if the progesterone's not helping it, that means it's not coming from low progesterone. So I would say that needs to be evaluated. You might have to do something to have that removed. Okay. Had my period on December 5th and on December 20th. I feel cramps and back pain. It feels like my period is coming. When does this occur? Why does this occur so quickly? I don't know yet, but that's what we're trying to figure out, right? That's what we need to figure out. And starting by looking at your lab work would be important. You shouldn't be having a period, day one of your period on December 5th, and then 15 days later. So we need to figure out why this is happening. And it starts with doing your lab work so we can understand what's going on. So that's where we need to go. All right. So for those of you who are just joining, we started off our time together, okay, today with going over how you're going to plan and prepare and set your intention for the new year. So if you're new, when we're done, I want you to go back and watch all of that so that we can, so that you can start to set your intention. That's how we started, because I think it's really important for us to make progress. We need to set intentions and have clear goals. Okay. With my Hope coaching members, I want a clear path forward. I want clear goals. I want them to have a process to follow. And so with everybody, we evaluate their case, we create a plan, and we try to follow that plan and then adjust as needed as we move forward. I want the same thing for all of you, right? But it starts with setting your intention for this year. If you want me and my eyes on your case to create your plan, to help guide you throughout your plan, help you understand why you're having the struggles and what to do to move forward and to create a personalized plan for you, then I'm going to invite you to set up a call with my team so we can see if we feel like we can support you and help you. You can learn more about the Hope program and see if it's the right fit for you. If that's what you want to do, then all you have to do is go to marksklar.com/discovery call. We're going to put that not on Instagram, but on YouTube. We're going to put that into the comment section for all of you. Okay, I see a couple other questions. We're going to jump to those. If you have more questions, go ahead and drop it into the comment section. Okay. Hi, doctor. I recently got my sperm analysis back. My morphology was 2%. Total count was 50 million. Motility 62%. The morphology part is really scaring me. How should I proceed? I'm 32. So here's the positive. Okay. The positive is that you have 50 million sperm. That's your count. And of those, 62% are swimming in a forward progression, doing what they need to be doing. Okay. So that's positive. Could your count be higher? Sure. But your motility looks great. Your morphology is that 2% is 2% of the 50 million. Okay. That's where that 2% comes from. It's 50% of, it's 2% of the 50 million. So if we could just increase that 50 million, say to 60, 70, 80, however high we can get it, even if we don't change that 2%, you've made progress. So I would be focusing on twofold: improving the count and the morphology. But I think at your age, there's a lot that you can do to support that. And I would start by cleaning up diet, getting plenty of exercise, good, healthy, don't overdo it, get plenty of sleep, just some basics. I have plenty of videos on my YouTube channel about this. I'm 34 and my AMH is 0.015. This was in July. I went off birth control and my AMH was 0.033. It went up. My vaginal ultrasound showed it came back normal. How do you recommend I proceed? I recommend that one, the longer you're off birth control, the more that AMH should improve. Two, that you test your other hormones to see what else needs to be supported and what else you can do to support your hormones. Because right now I would be focusing on improving egg quality and making sure you have a regular cycle and that your ovarian function is working properly. So that's where my focus would be. It takes a deeper dive into your lab work. I don't know what else they've done, but it would take a deeper dive into your lab work to look at that. Okay. So someone says, oh, she's in my program. To get updated labs, so email and post it on the Facebook group. All you have to do is log into the member portal and submit a lab request form. This is for someone in my Hope program, by the way. It's that easy to get lab work. Just submit a lab request form and we'll go ahead and request what we think you need because you've already had everything done. So we'll look back at your file and do that. Somebody else says, is there a way to increase DHEA naturally? There is. I don't think the DHEA is not just a reproductive hormone. It's also an adrenal hormone, a stress hormone. So the first thing that I would want to do is to understand how stress has been impacting you, because likely if it's been chronic, it's also impacting your DHEA levels. Okay, so I would like to see that improve. That would be one of the first things I'd like to see improve. Then we have to decide if you need anything else, and if so, what that is, and how to go about that. But I would need to look at your other hormones, because it's not so easy to just make those recommendations without seeing the full picture. With diminished ovarian reserve, is there a specific protocol that you recommend for IVF? Is there a lower chance of conceiving with diminished ovarian reserve with IVF? So what I recommend, where's this guy trying to go? What I recommend, sorry guys, there we go. So what I recommend with diminished ovarian reserve is a lower stim protocol, not a higher stim protocol. I want to try to go low and slow and really focus on egg quality versus how many eggs we can get in the protocol. But I would say you only have lower chances of conceiving with DOR with IVF if you're not working with the right IVF clinic and right team. Are mitochondrial improving peptides helpful to improve egg quality? Possibly. They could be. Yeah, it depends what we're talking about. There's not enough research around that, by the way. What can I do to prevent early ovulation? I ovulate on day 10 or 11, and I know that is not normal. So I don't know, because I need to understand why. Likely we're working with your follicular phase and the hormones that are dominant there, but until I look at your hormone levels, I'm not quite sure what we would do. So I apologize for that. I know it's vague, but I know where I would start, and that would be looking at your hormones. You want to be off, buddy? But I would need to understand, I need to look at that to be able to guide you more accurately. FSH of 15 at age 40, a bad sign for fertility? Not necessarily. Yes, it's higher than we'd like to see, but what does everything else look like? What does your LH look like? What does your estradiol look like? What else do your other hormones look like? I don't look at one hormone in isolation for anybody, just so you all know. I look at all of them together because I want to understand what your whole body is doing. That's how I approach things. So when I'm looking at your, and I'm not trying to be vague here for you all, okay? When I'm looking at, go ahead. When I'm looking at your hormones, this goes for members in my HOPE program. I want to look at it all together so that I understand the entire picture and I can guide you specifically on what needs to happen. So that's what I'm looking for, okay? How to take both DHEA, this is the question, how to take both DHEA and myo and D-chiroNS at the same time. It was recommended by the fertility specialist without knowing levels. No history of PCO. So if you don't have a history of PCO, I don't know why you're taking both myo and D-chiro. I don't think it's necessary. The D-chiro is contrary to what the DHEA is going to do. It's hard for me to tell you what to do. One, because I don't know your case, and two, because I don't know why someone recommended this. Like, this wouldn't be an approach that I would take. So I can't really answer that question. I can appreciate why you're asking the question, but I would be approaching this very differently. Let's see here. All right. 40 years old, want another baby, have one normally tested embryo frozen, but haven't had a period since October 14th. My mother went through menopause at 41. Nervous, I'm in menopause. What can I do? I would start with having labs tested, and I would do and seeing what we could do to jumpstart your cycle, your normal cycle now. That would be where I would start. Yeah. But making sure that what often happens with baby number two, when you're trying for baby number two, when you've already had baby number one, is that you've neglected yourself. So I would like for you to put yourself as high up and as close to priority number one on your priority list as possible, recognizing that you're likely only to get to number two on that list, and do everything you can to take care of yourself, because I know that you're probably focusing on the baby. And I think that would be the first thing I would do. Someone else says, I'm birth control. I'm on birth control IUD. Can it affect my chances of getting pregnant when I need it? I'm 27 years old and not married. I'm not a fan of birth control unnecessarily, and I'm not a fan of IUDs because I think they cause more problems than good. If there's no real reason for you to be on birth control, then I would be using condoms as birth control, and I would just be careful. I know that sounds simple and basic, but that's what I would be doing. I wouldn't be on birth control. If there's a reason that you're on birth control, then I would be doing everything I can to address that reason naturally and at the root cause, instead of just taking birth control. Okay. Let's see here. I'm on bovine thyroid pill because I wanted to do what was the most natural. Is that going to sustain a pregnancy if I think I have hypothyroidism? I don't know what your TSH levels are. If you think you have hypothyroidism and your TSH levels are elevated, and you get pregnant, it's likely that bovine thyroid pill is not going to do enough to sustain and manage your thyroid health, and you're going to have to manage it differently. So I would just be actively engaged with managing it. I would be tracking it regularly, and I would make sure that you're getting proper support from your healthcare team. Yeah. So the someone asked, does Viagra or Cialis impact sperm negatively? It does not, but the PDE5 inhibitor can. I know some urologists prescribe it for ED, but I've read older studies that may negatively affect sperm. So that's just my initial thought on that. I think the inhibitor is worse. Can I join the HOPE program while being followed up by my fertility donor? Absolutely. Look, we support couples who, at every stage, about 50% of the couples in the HOPE program are going through IVF, working with their fertility clinic, and we're supporting them, and we're a resource, and we're coaching them through that. So absolutely. We're also going to fill in the gaps that they don't cover. We're going to be putting in the pieces that they don't really address. And we're able to do that with the HOPE program. So that's not a problem. We do that all the time. And then when recommending detoxing, what do you typically lean towards? I'm not sure your question here. I'm 27, 3 years trying to conceive, PCOS, potential signs of candida. Per acupuncturist, my blood is stagnant. Yeah, I'm not working with you directly, so this is really difficult for me to answer. There's a lot here that I would want to address, but I don't know your question about the detox specifically. Typically, what I ask everyone to do is clean up their diet, right? Eat clean, don't stray from that. Because you've got potentially candida, I would say, avoid dairy, avoid fried foods, avoid sugar. Those would be the big things, and just eat as clean as possible. To your other issues here that you mentioned, PCOS, which I can totally address, or the blood stagnation, which I can totally address. I don't know how to support you with that until I dive deeper into your case. And I wouldn't feel comfortable mentioning something here for that. So, okay. I see a question here that I'm going to answer real quick. It says, does using jacuzzis or having really hot showers affect fertility in any way? I'd stay away from the jacuzzis. The hot showers should be fine. And then someone here says, yeah, is cycling very bad for male fertility? How much is okay? My husband loves cycling and his main exercise, and it keeps him healthy and helps his ADHD. Look, I would minimize how long he's on that seat and how aggressive he's going for. I don't think it's ideal, but what I would do before and after, if I was him, is I would be icing his testicles. Yeah. Not directly on the skin. The only reason I feel like I have to say this is because I've had people not do this. So I thought it was a given, but I'm going to be clear. Like a towel in between, but icing for 15, 20 minutes before and after, I think would be super helpful in this situation. And I just wouldn't go for very long. Like, try to pull back. I know it's helpful for him, but I would try to pull back on it. Okay, let's see. Let's see who else. Okay. I don't know how to answer this question. Someone said my insurance doesn't cover IVF nor IUI, and IVF is very expensive. So how can I do IUI? I mean, theoretically, you can't. I would say the closest thing that you could do would maybe be a home IUI or home ICI, and that's relatively inexpensive. Yeah. Is there a way to know if miscarriage was caused from a defective egg or poor egg quality is what I would say, or was it the sperm? You'd have to do testing to figure that out. So that would be the only way to know that, is you'd have to do some testing to determine that. Yeah. Awesome. This was great. I think we've all been together for about an hour, it seems like. So that's great. I appreciate you all being here with me and bringing your questions, more importantly. Now, your homework is to go back and isolate the 3 things you want to improve this year. You're going to separate them out, and you're going to come up with a plan of how to accomplish those things. Okay. And you're going to start that now. Okay. If you want help, if you want support from me and my team to look into your case deeper, guide you in what else needs to be done in terms of investigation, and tell you what our findings are, and create a personalized plan for you. That is what the HOPE program is all about. And I encourage you to click on the link that we're going to drop into the comment box right now. It's marksklar.com/discovery call, where you can set up a call with my team. We can learn about your case to see if we feel confident in supporting you, and you can learn about the HOPE program to see if it's the right fit for you. All right, everyone, I want to wish you all a happy new year. I appreciate you all being here with me. And I look forward to supporting you in the new year in 2026. So you guys have a wonderful evening and an amazing year. And let's all make this happen this year. Okay, everyone? Adios. Bye. You have a good night.